Hi everyone. In this video we will see step-by-step approach of securing an arterial line in a radial artery. First, position. Position the patient hand with 30 to 60 degrees of extension by propping the dorsal wrist surface on a roll towel or other supporting structure with the ventral surface up. Remove all objects from the patient wrist and clean the skin with an antiseptic solution such as chlorhexidine or betadine. Create a sterile field by draping the wrist and donning a sterile gown and gloves. Palpate the radial artery on the patient's wrist with the first two fingers of the non-dominant hand 3 to 4 cm proximal to the crease at the base of the thenar eminence. While palpating gently with the non-dominant hand, enter the skin at a 30 to 45 degree angle. Just caudal to the fingertips of the non-dominant hand. Pressing too firmly on the radial artery can occlude flow and make cannulation difficult. When the flash of blood occurs, hold the needle steady and advance the guide wire into the arterial lumen, which should meet little resistance. Now remove the needle while leaving the guide wire in place and replace it with a catheter. Connect the catheter to the transducer tubing. And flush the device. Secure the catheter to the skin with a suture or adhesive device. Clean the skin and catheter with antiseptic solution and cover with sterile dressing. Now connect the transducer to the monitor. And now you can see the invasive arterial blood pressure monitoring. Thank you for watching this video.